Hey, it's Taylor from Rant, and today we have another tactical medical component, and we're talking about fluid resuscitation on the K-9 patient. So we as paramedics are intimately familiar with intravenous catheterization as we're normally doing multiple IVs on somebody in a single shift. If you can't get an IV, keep your human protocols in mind, because even when it comes to canines, if you cannot perform an IV or gain IV access, consider an intraosseous access on them. The bone marrow, just like in humans, is a semi-fluid, blood-forming tissue that is encapsulated by non-expanding bone and therefore does not collapse during circulatory failure. The fluids and medications injected into the medullary quickly enter into the venous circulation through the medullary capillaries. Several studies have shown that fluids and medications injected intraosseously enter the circulation at similar rates when compared to central or peripheral intravenous injection. IO catheterization can be performed using a variety of materials, including hypodermic needles, spiral needles, bone marrow needles, and commercially available IO catheters. Now, just like in humans, there are contraindications. So for our canine patients, IO catheter placement is contraindicated if there's a known fracture in any of the bones, there's a local skin or tissue infection, or there's been a recent IO catheterization at the same insertion point. As far as catheter placement goes, the most commonly used sites for the IO placement on the canine patient are either the proximal humerus, proximal medial tibia, or the distal lateral femur. So with that said, let's go ahead and demonstrate how this would go. Okay, so we have our sick or injured canine here. He's going into shock. We tried getting IV access on him. We were unable to, so he's in circulatory failure. So we're going to go the IO route. The first thing we need to do is ready our equipment. So if you're using the Easy IO set, which has worked very well for us, you'll notice that they are weight-based. This one is for 3 to 39 kilograms. The mean of your working dogs is right around 35 kilograms. So the pink needle set is perfect. We check our drill, make sure it's good. We can open this up, remove our tubing. We can attach our needle to the drill. We have our syringe. So what we're going to do is, the first site we're going to utilize is the proximal humerus. So we just feel around, we feel where the bone is, we find our site. In an actual canine patient on a real dog, you would need to take a scalpel and just do a small laceration and cut the skin, because you insert the needle on the drill into a dog, because their skin is so loose. As soon as you go to advance the drill or advance the needle, the skin will just bind up around the needle and stop the drill. So on a real canine patient, we would just do a little stab incision. For here, we're going to skip that, but we feel around, we locate our site, we remove the needle, we press it against, and we insert it. It goes down. We confirm we have a good hold. We'll remove the needle, secure our sharp. Right from here, we want to take our empty syringe, apply it on, and then we're going to aspirate to confirm placement. And what we're looking for is a little bit of bloody bone marrow. Once we confirm our placement, we can remove that, attach our tubing set, and then from here, whatever medication we were going to administer or whatever fluid resuscitation we were going to start, we can do so right through the IO route. So this is site number 1. So for an alternative site, if for whatever reason any of the contraindications exist on our front portion of the dog, we can't get IO access there, the other spot we can use is the distal lateral femur. And basically what we're looking for is the nice flat spot kind of just below where his knee would be. And then our procedure is virtually going to be the same. We're going to do the stab incision again. We take our scalpel, we make a little incision, we have our site palpated. Our drill would already be established. We have everything set up. We're going to just place it where we made the incision, squeeze the drill. It would go down. We remove our sharp, secure it, Again, take our syringe, confirm placement by aspiration of bone marrow, remove it, again attach our administration set, and then again we could do any medication, any fluid resuscitation we wanted to right through the IO route. Well, that's all I have for you today. I hope you liked it. Please give us a like, hit the subscribe button for more content. Also go to the websites, ranchstrategies.com or medicineandbadplaces.com. All of our upcoming training courses will be listed on there, or if you just need more info, shoot us an email. We'll see you next time.